that soil erosion is very much similar to dental attrition. If they only add soil without controlling the flow of water, then the soil washes away again. Not all generally treated cases need full mouth rehabilitation. After following step number 2 and 3, the efforts that he had imagined for step 4, which may have been required, become less. An intelligent caregiver practices minimally invasive dentistry, and he does that by keeping the people at the base of this pyramid. Hi guys. Last time I showed you how a full mouth rehabilitation may not always need full mouth treatment in all of the structures lying in there. Let's have a quick recap. Now from this table, you look at the signs that the patient is showing you and you find out which stage the patient is standing at right now. This table represents a pyramid, which is broader at the base and narrower at the top. It means that you will find more number of cases at stage 1 than at stage 6. So after you have found out at which particular stage your patient's system is standing right now, you take a pause before jumping to higher level of interventions. You start from the base of pyramid. You start least interventions with more efficiency. Because an intelligent caregiver practices minimally invasive dentistry. And he does that by keeping the people at the base of this pyramid. Now the question arises, how do I keep people at the base of this pyramid when they show up with generalized attrition? So let's take a look at the same table from a different perspective. Now I have added a column on indicators of successful completion in this table. Now here in this table, it means that you will choose the intervention of stage 4 only and only if the indicators of success at stage 3 intervention are not seen, and also vice versa. It also means that if you reach at the success indicators mentioned at stage 3, then your treatment stops there itself. You don't need to climb the ladder higher. As you can see in the last column, you are saving the patient from extra costs. And now you can be rest assured that whatever restorations or whatever work you have done, intervention you have done in the patient's mouth until now will stay longer, because you have stabilized the environment of your work. So how does all of this make sense? Let us understand through an analogy. Let's take an example of soil erosion. Imagine a farmland which is exposed to rains, wind, flowing water over years together. Now, soil erosion doesn't happen in one day. It happens with small, repeated forces of these water and wind. Similarly, dental attrition doesn't happen in one day. It happens with smaller, repeated forces of chewing, swallowing, clenching, or other muscular activities. These forces reach the teeth through our periodontal ligaments and temporomandibular joints. And that's how attrition happens. So I mean to say that soil erosion is very much similar to dental attrition. So now when a soil erosion happens in the farmer's land, the farmer doesn't immediately directly get soil and dump it on the land. He follows a particular sequence and a method. What he does first he studies the pattern of the soil erosion. Then he directs the flow of water. Then he protects the surface of the land. And then he adds soil over that surface. And then it stays. And the most interesting part is the 4 steps that the farmer follows when he does that sequentially. After following step number 2 and 3, the efforts that he had imagined for step 4, which may have been required, become less because nature responds. And this is very true in clinical application in dentistry as well. You will find that if you directly restore teeth, build teeth, without stabilizing the forces around, then they may fail. Similarly, attrition. The main problem in attrition is not loss of tooth structure. The main problem is the flow of forces through the system because of the muscles, the joint, the airway, the habits, and the occlusion. When these forces are not stabilized and you directly place restorations without addressing these forces, then you have a higher chance that your restorations will fracture, will become loose, or will wear out, or the patient's joints may hurt, muscles may pain. So you need to follow a particular sequence as the farmer did. First, you preserve what remains. Then you stabilize these forces acting inside the mouth because these stabilize the environment which supports the structures inside that environment. And once the stabilization is done, then you protect the teeth. Then you start restoring them gradually and replace only when necessary. Coming to the next table. So when you look at seemingly difficult cases like attrition, generalized attrition, you may think reconstruction, but nature always asks for stabilization first. So not all eroded land needs rebuilding. Not all generally treated cases need full mouth rehabilitation, but many cases get resolved with just addressing these smaller directing forces and perpetual preservation of what is remaining there. Because the goal of dentistry is not perfecting teeth by building them. The goal is a human being who can chew, swallow, speak, breathe, sleep comfortably, and smile genuinely. If you want to join my community of dentists which work for flow based practices in dentistry, the link is below. But remember, the goal is not perfection, it is flow. Thank you.